I've been working a lot, and so my neck feels extremely heavy. I'm bending over a lot. There's a lot of tension in my posterior neck, going all the way up my head, and I don't have great range of motion, and I'm feeling like I'm clenching my jaw quite a bit, and so this whole area, all up and down my traps and my neck, are going into my jaw, and I feel like I just can't move my neck the way that I should be able to.
Is it mostly on the left? Is it the right? Is it both sides?
I think right now I'm feeling more tension and pulling on the left side, but both sides are pretty affected.
And as I recall, you don't do well with cervical manipulation.
Right.
You like gentle, more in the myofascial work, and the gentle, more induction of movement rather than the forceful movement.
Right.
So that's what we're going to do.
Yeah.
I like to start with a gentle touch. Lately, I've been really kind of focused a lot on the gentleness, like how gentle can I be? How light can my touch be and still feel what I want to feel? And it's surprising because sometimes the answer is the less pressure you use, somehow weirdly, the more you can feel. And I think that's partly because using a lot of pressure can tend to evoke a bit of a guarding response in the patient. And so then you're kind of, you're instigating more tension in their body, which makes you feel like you need to press harder to feel through it, which makes them more tense. And so then you're in a little contest with the patient, which is not really what we're going for, right? And the other thing is remembering that just from a neurological standpoint, I can't actually feel inside the patient. All I can feel is what is happening in my own tissue. And so the texture, firmness, mobility, tone, temperature, bogginess, those are all things that I sense as, when you boil it down, you sense those things as deformations of your own skin and the nerve endings in your skin and your joints. And so how do we minimize the amount of noise in that signal? And I think when you use a lot of pressure and your muscles are really activated, especially the muscles in your hands, that's creating a lot of sensory noise for you, which is going to get in the way of you sensing what's happening in the patient's body. Now that said, I do think that our ability to sense through our skin and our skin receptors is incredible and underutilized in medicine today. Many doctors never even touch their patients, which I think is such a missed opportunity for gathering information as well as creating connection with your patients. And so, obviously, this practice is totally based on the touch. So everyone who comes in here gets touched. So what I'm sensing in Ashley is, I know you were talking about your left side feeling really tense and tight, and I'm keying in on the deeper tissues on the left side, the scalene and the levator scapular region being tight. Also keying in on this right upper sternocleidomastoid, having some trigger point activity in this upper third. You see that a lot on people. And this is very impactful because that SCM attaches to the mastoid process, which is on the temporal bone, but that temporal bone is very closely, firmly attached to the occipital bone. And so when that SCM on the right is tight, it's going to pull that occiput inferior on the right, vice versa on the left. And then when your occiput is stuck on one side or both, it will have a domino effect on the posture through the whole body. So it could be that part of the reason Ashley's neck feels so heavy is that this occiput is not quite sitting right on her atlas. And as you often see, when the occiput is out on one side, you'll see something in the neighborhood of C234 on the other side as it's trying to counterbalance. So it's much easier to adjust C234 than it is occiput. So a lot of times chiropractors who are going for the crack will address the easier one and leave the problem. So I don't want to do that. But in terms of like upper trap tone, it feels okay. It's not super tense and tight. I have to remember that Ashley is a bit hypermobile. And so what's, quote, normal tone for her is gonna be a little bit loosier-goosier than it is for the typical population. So we have to kind of account for that. Any questions so far, Ashley?
No.
Okay.